High-intensity group workout classes are increasingly popular at health clubs and gyms. Research has shown that high-intensity strength and movement workouts can have cardiovascular and other benefits, but few studies have been done on whether the high-intensity workouts lead to more injuries. Hi, I'm Dr. Ed Laskowski, a physical medicine and rehabilitation physician and co-director of Mayo Clinic Sports Medicine. I'd like to share with you our article entitled Injury Rate and Patterns in Group Strength Endurance Training Classes, which will appear in the March 2020 edition of Mayo Clinic Proceedings. We performed a study at Mayo Clinic Rochester that closely tracked 100 participants in a 6-week high-intensity functional training program. High-intensity functional training programs, or HIFT programs, use highly varied combinations of functional movements. And functional movements are movements that are based on the way we move in real life, usually involving multiple muscles and joints. And high-intensity functional training is done at a high intensity for a short time, followed by a period of rest and recovery. They're part of a broader category of high-intensity interval training, or HIIT, H-I-I-T, which is primarily endurance or aerobic exercise without the strength component. High-intensity functional training tends to include more strength training and functional movement patterns, and examples of high-intensity functional training programs include boot camp style exercise classes, some military training classes, CrossFit, or other variations of training that combine strength and endurance training. The strength training component may include use of kettlebell movements, barbell movements, dumbbell movements, or calisthenic or bodyweight movements. Ballistic movements, such as variations of the Olympic lift, clean, jerk, and snatch, and plyometric exercises such as box jumps, jumping rope, jumping squats, may also be a part of these workouts. These types of classes have become very popular. But other than studies of similar programs in military training, there were no prospective research studies on injuries that can occur in these types of classes. Our study involved 100 adults, 82% of whom were female, who participated in a high-intensity functional training class at the Mayo Clinic Dan Abraham Healthy Living Center from January 2017 to April 2018. 60-minute group workout classes were held weekly for 6 weeks, and participants completed a survey before and after the classes ended. Participants in our study had the advantage of a very small instructor-to-participant ratio, which allowed for closer monitoring of technique of exercise and movement patterns. Injuries were self-reported, and the most common injuries were to the knees and to the back. Burpees and squat exercises were the most common exercises causing injury. We found an injury rate of 9 injuries per 1,000 training hours during the 6-week training, compared with 5 injuries per 1,000 training hours during the 6 weeks before enrollment in these types of classes. These findings show a trend toward an increase in injury during the course of a typical class, but our findings were not statistically significant when we compared them to injury rate studies of other less intensive workout programs. The injury rate in our high-intensity functional training population was higher than previously published rates of injury during high-intensity functional training. The injury rate of 9 injuries per 1,000 training hours in this study was approximately triple the 2.4 to 3.1 injuries reported in the literature for high-intensity functional training programs. Unlike in previous studies, upper limb injuries were not common in our population. This difference may be attributed to the low use of ballistic weight training movements during our classes. Emphasizing proper technique and movement pattern is very important in all exercise, especially strength training. Most injuries in our study were related to movements that were either ballistic or that have an increased risk of injury if not performed with optimal technique. Remember, it's perfect practice that makes perfect. If you perform a squat exercise improperly, you risk injury to your back. If your knee is not in proper position during jump landing or cut and pivot activities, your knee ligaments could be at risk. Though not statistically significant, the injury rate in our study was almost 3 times the rate reported in previous studies involving high-intensity functional training. Hopefully, these results will provide a stimulus for future studies and for interventions, including focusing on optimal technique and eliminating exercises that are higher risk when not performed correctly. And these measures hopefully will help reduce the risk of injury. We also emphasize in the study the importance of exercise class participants informing the class instructor of pre-existing injuries or medical conditions. Usually the class can be adjusted according to what your injury is to minimize the risk. Monitoring for fatigue during the workout and modifying or eliminating exercise that may put an individual at risk are also important aspects of injury prevention. We hope that our study and the growing popularity of high-intensity group workout programs leads to more research on the benefits and risks of these types of programs, with really the goal of further reducing the risk of injury. The United States continues in the midst of an epidemic of obesity and sedentary lifestyle. Programs that promote physical activity, such as high-intensity functional training, can help to mitigate the effects of this epidemic and provide the motivation needed to get people moving.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.